Hello, America. I'm Mark Levin, and this is Life, Liberty, and Levin Saturday. Two great guests, General Jack Keane. Have a lot to talk to him, like, is Hamas going to be destroyed or not? And our friend, Katie Pavlich. We'll get into that in a moment. You know, ladies and gentlemen, I hear the Democrats keep talking about how they want to fix health care and how illegal aliens are not by law allowed to get health care. And as is typical with a subject like this, we're getting no clarity from the media. The media, you know, the pom-pom boys and girls are dancing for the Democrats and so forth and so on. We have this so-called government shutdown. And the media is saying it's about health care, and the Republicans won't negotiate, and Trump won't negotiate, and the health care premiums are through the roof. Let's walk through this. Now you're going to understand this completely. First of all, language. And then I'm going to get to this. This is important. Language is a tool. It can be abused. The goal is to communicate. To communicate what? The truth or falsity. In the case of the Democrats, they seek to manipulate, mislead, intimidate, and coerce. They use complicated language when it comes to passing laws and bills, and yet sloganeering to hype their position. This is typical of tyrannies, totalitarian regimes, leftist parties in Europe, and of course, the Democrat Party. They want to subvert civil discourse. You hear Hakeem Jeffries saying the Republicans are going to kill 5 million people. They're going to kill 1 million people. They're going to kill people. This is sick. They do this in service to the Democrat Party and their ideology. They want to fuel what's called agitprop. I've talked about this before, and I've written about it in my new book. What is that? That's a Leninist ideological approach. Language is used to incite, including violence. You hear this from the governor of Illinois, you hear it from the governor of California, you hear it from these mayors, all Democrats, and again, you hear it from Schumer and Jeffries. It's used by totalitarian regimes and left-wing Western parties like the Democrat Party, and they've applied it in spades to this so-called government shutdown. Democrats use this language and these tactics of authoritarianism. They use the word authoritarianism to project onto you and me and the president and the Republicans who they actually are. Another neat trick of the Maoists, of the Castroites, and all the rest. So now I'm going to explain to you what's going on, because I've spent many hours studying this now, and I needed to understand it, because you're not going to get it anywhere else. This I promise you. What exactly is going on? The Democrats are destroying Medicaid, Medicare, private health care, employee subsidized insurance, ESI. They're destroying our healthcare system, piece by piece. This is another big piece. And they do this while claiming to defend it, while worried about your premiums, which are going through the roof. Why? Because Obamacare is destroying healthcare. Every single Democrat voted for Obamacare. Joe Biden, in one of his illustrious moments, where he was relatively coherent, remember he whispered? He whispered to Obama when they had a massive signing ceremony, all Democrats, and he said, this is a big effing deal. It's about the best you're going to get out of Biden. And it was. And it is destroying our healthcare system. It is driving up premiums like never before. It's limiting your access to doctors. It's reduced the quality of healthcare, because that's what centralized government healthcare does, but they want more. This is why Bernie Sanders, the chief red, the big commie, this is why Bernie Sanders says, we're not opening the government until we get what we want. He doesn't even want just a vote on increasing subsidies for Obamacare, which I'll get to in a moment. He's telling the Republicans, you give us what we want, the outcome we want, or else. This is pure blackmail. Blackmail. A continuing resolution is basically a ministerial act where you continue the spending and the programming at certain levels in order to get through the appropriation process at the end of the year. They said, no, we want government-run, nationalized, universal health care. We are prepared right now to destroy Medicare, Medicaid, private health insurance, employer-subsidized insurance right now. Or the TSA doesn't get paid, or the FAA doesn't get paid, or the military doesn't get paid, and so forth and so on. They want to collapse the system and replace it with what they want. while they claim to be defending the system. It's a neat trick, but we're not going to allow it here. So what's going on? Look how it's covered, the Washington Compost, a.k.a. the Washington Post. Millions of Americans are already seeing their health insurance costs soar for 2026 as Congress remains deadlocked over extending COVID-era subsidies for premiums. That's not what's deadlocking Congress. The Republicans and the president are saying, let's get on with this. Let's get the continuing resolution passed. Then we'll have a debate over health care. The Democrats will say, no, we want our Soviet-style health care and we want it now. And they think they have the leverage. The bitter fight, writes the Washington Post, sparked a government shutdown at the start of October. That's not what sparked a government shutdown. Democrats refuse to vote on government funding legislation unless it extends the subsidies, the Obamacare subsidies, while Republicans insist on separate negotiations after reopening it. So the Washington Post, like most of the media, are basically regurgitating, burping up the talking points of the Democrat Party, as you can assume they would. Healthcare.gov, the federal website used for 28 states, is expected to post plan offerings early next week, ahead of the start of open enrollment in November. But window shopping has already begun in most of the 22 states that run their own marketplaces, offering a preview of the sticker shock to come. Premiums nationwide are set to rise by 18% on average in 1 year, according to an analysis of preliminary rate filings by the nonpartisan health policy group KFF. I don't know if they're nonpartisan or not, but there they are. That, combined with the lots of extra subsidies, have left Americans with the worst year-over-year price hikes in 12 years since the marketplaces launched, since the beginning of Obamacare. The situation is particularly acute in Georgia, which recorded the second highest enrollment of any state-run marketplace this year and posted prices for 2026 earlier in October. About 96% of marketplace enrollees, these are Obamacare enrollees, in Georgia received subsidies this year, according to the Center on Budget and Policy Priorities, a liberal think tank that supports extending the subsidies. Now Georgians browsing the state website are seeing estimated monthly costs double or even triple, depending on their incomes, as lower subsidy thresholds resume. The enhanced subsidies had fully covered monthly premiums for millions of lower-income people in the marketplaces. Many of them will have to start kicking in some of their own money starting January 1, while people with higher incomes will see their monthly subsidies shrink. The subsidies shrink even for the higher income. People earning more than 400% of the federal poverty line will no longer be eligible for subsidies at all. Wow. What did you learn from this about Obamacare? Nothing. What did you learn about this, about the government's role in driving up subsidies, driving up premiums, driving down quality and availability? Absolutely nothing. This could have been written by the DNC, the Washington Post. What do we know? Let's dig in from the Competitive Enterprise Institute. The problem with Obamacare is Obamacare. This year, the COVID-induced expansion of the Affordable Care Act. Isn't that funny? Like the Inflation Reduction Act drove inflation up. The Affordable Care Act is destroying our healthcare system. It's unaffordable, but it's the Affordable Care Act. That's what I'm talking about with propaganda from the left and the Democrats and their media. It's going to expire. Extending the expanded subsidies has become a point of contention between Republicans and Democrats, and the clock is ticking. The end of the year. Marketplace enrollees will start choosing their plans in a month. Obamacare. The expansion of ACA, Obamacare. ACA subsidies can be broken into two components. Originally, the ACA provided subsidies only for people earning between the federal poverty level and 4 times the federal poverty level, between 100% and 400% of the federal poverty level. Those subsidies decreased with income. So your income goes up, the subsidies decrease. So that the higher the income, the farther away from poverty, the more the individual was expected to pay to kick in, and the lower the taxpayer's share would be. If a person was in a household that earned more than 4 times the poverty level, there were no subsidies at all. Okay. The COVID expansion of Obamacare, in comes Obamacare, and it's expanded. It's expanded for the people on it. It's expanded to include people over the 400% threshold, like everything else was expanded. And the Democrats haven't retracted any of it. Massive increases in spending as a result of COVID-19, which they never want to pull back. The COVID expansion of Obamacare expanded the subsidies in 2 ways. It increased subsidies for people earning less than 400% at the poverty level. Okay, their subsidies increased. But for the first time, it also provided subsidies for people above the cutoff level, over the 400% level, 4 times poverty. These were designed just as those in the original Obamacare were, to phase out gradually as income increases. Today, a major argument from the left to extend subsidies is that people above the 400% level cannot afford health insurance either without the subsidies. So the increased subsidies for those at the poverty level and 4 times the poverty level should not only stay but increased, but the increased subsidies and the addition of subsidies to people over the threshold should continue and be increased. This will cost hundreds and hundreds of billions of dollars to the taxpayers. Obamacare is a complete and utter failure. Remember, it was supposed to reduce premiums across the board by $2,500. They lied, he lied, the media lied, every Democrat voted for it. I believe every Republican voted against it. People who could purchase insurance and pay less than the affordability threshold would receive no federal subsidies because the Obamacare program deemed insurance as affordable for these people. So the architects of Obamacare didn't believe it was necessary to extend the subsidies beyond 400% of the federal poverty level because few would need them with premiums at the time. So what's happened? Obamacare blew up the system. It blew up the premiums. It blew up the cost of health care. If the Obamacare had worked as promised, premiums would have risen much slower than they have. In fact, premiums have risen so fast, it has undercut the original design of the program. And now politicians are calling for an expansion. The program's blown up, and the Democrats want to expand it. Typical, isn't it? In any context, it's unwise to spend additional money on a failed program without reforming it to fix the underlying problem. And it is no different with Obamacare. So the Democrats are saying, we don't want to fix it. We want massive increases in inflow of money into Obamacare. This is how the Education and Labor Committee, the Republicans, put it. 12 years ago, Democrats unloaded the Affordable Care Act, also known as Obamacare, onto the American people. Since then, the costs of health care and insurance have skyrocketed. Here are 5 reasons why Obamacare has done so. Even those on Obamacare exchange are facing difficulties because unsubsidized plans are plagued with extremely high deductibles. An average family of 4 receiving unsubsidized coverage through Obamacare must spend $25,000 out of pocket on premiums before insurance kicks in. This is unaffordable for most families, particularly during an inflation crisis. Again, Obamacare. Additionally, many Obamacare plans have narrow networks that tend to exclude the best hospitals and best doctors in certain areas. Conversely, employer-based plans typically provide richer and more comprehensive coverage than plans offered on Obamacare exchanges. In simple terms, more options mean better coverage. So what do they want to do? They want to destroy the employer-subsidized plans. They want to expand Obamacare, devour the private plans, and pool them under Obamacare. Massively increase the subsidies to Obamacare. Number 2, Obamacare increases American reliance on the federal government. Over 155 million Americans rely on and are satisfied with their employer-sponsored or ESI plans. In fact, 75% of Americans say that coverage played a role in their decision to accept their current job. Democrats are attempting to destroy the powerful benefit for employees and increase workers' reliance on the federal government by moving them into the exchange plans with higher deductibles, lower actuarial value, narrower networks. So Obamacare is imploding. It's taking most of the healthcare system with it, government and private. And the Democrats say, well, we just need to pay more money for Obamacare and bring more people into the system. That's the fight. Now that Obamacare is considered the law of the land, multiple Democrats have called for its expansion by siphoning Americans from employer-sponsored coverage. They're accomplishing this by weakening the firewall between these employer subsidy insurance plans and Obamacare plans. The firewall currently keeps workers in their employer-sponsored plans, which keeps employee-sponsored insurance risk pools healthy and premiums low. And the Democrats' Build Back Better America would weaken the firewall and force many of you who have private plans through your employers into Obamacare, which is imploding. That's their plan. That's what Hakeem Jeffries won't tell you. Bernie Sanders, that's his dream. That's what the media won't tell you. On a per-person basis, Obamacare is far more expensive than anticipated for taxpayers. Now, what else? Are illegal aliens getting health care? Now, Mark, you said that Obamacare is blowing up the other system. When you drive up the cost of doctors, the cost of hospitals, the cost of prescriptions, because Obamacare is imploding, You drive it up for Medicare, you drive it up for Medicaid, you drive it up for all private insurance programs. And the Democrats want to expand it. They want to steal your private health care. They want you to have inferior health care, but they want to be able to say everybody has health care. You know what? I'm not interested in the Cuban model, the Venezuelan model, and all the other failed models. Just because everybody has health care doesn't mean everybody gets medical attention. There is a difference, you know. Center for Immigration Studies. Of course, illegal immigrants access public health care benefits. It is illegal for illegal aliens to get health care. You've heard senators like Senator Coons from Delaware go on and repeat himself and yell over hosts and say, "Oh, you're not allowed to get it." What did they do? What did they do? Well, the Center for Immigration Studies points out that you have different categories of illegal immigration that the Biden regime essentially made legal, at least temporarily. It's like Mondami wants to reduce crime in New York. How? By eliminating misdemeanors. Okay, I guess that reduces the phraseology if you use the semantics. So it's semantical. So they get on TV, these Democrats, it's illegal. You get CNN and MSNBC hosts and others who say, but it's illegal. Here's the provision, it's illegal. What Biden did is millions and millions of illegal aliens were, through word games, said to be here temporarily legally, on parole, 5-year wait period. And so they're not technically illegal, say the Democrats, even though they're still illegal under the law. They say they're not technically illegal. That's what they're saying. Huge numbers, millions, are now on Medicaid and other government programs. You know, people don't realize, even putting Medicaid aside, illegal aliens get free health care. They walk into emergency rooms and so forth. So if you flood the country with 20 illegal aliens and they have access to the emergency rooms and they were having access to Medicaid and so forth, that's an additional weight on the system in addition to what they've done to Obamacare. They're destroying health care in America. That's what they're doing. And they're demanding through blackmail that the Republicans join them. Not on a vote, on the outcome. They want the outcome. They're saying, you do what we say. You expand Obamacare. You increase taxpayer subsidies to Obamacare. Don't reform it, expand it. And yes, you reverse course on the president's big, beautiful bill. And you include illegal aliens in that health care. But they don't call them illegal aliens. They call them legal. I guess that fixes it. You do those things, or the military's not getting paid. Now you should better understand what the Democrats are doing it, how they're doing it, and why they're doing it. I'll be right back.
Click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis. You won't get it anywhere else.